Should you open up a separate TMJ and sleep practice? We're going to talk to a guy who's done it before right here on Marketing Chairside. Hi, welcome to Marketing Chairside, and today I'm joined again by Dr. Jeffrey Haddad.
I'll try to exceed expectations.
Yeah. Well, so last time you were on the show, we talked about, I had all the intentions of getting what I want to talk about now on that show, but we just ran out of time. We talked about the problems that dentists run into when they want to add more TMJ and sleep patients to their practice. And by the way, if you're watching this and you're like, that's what I want to know, you can find that link in the description. But today, Jeff, I want to talk about what led you to open a second office that is under a separate brand. It's not just a different location, it's a whole separate brand. I'll pull up the website here and would you tell us about how that came about?
Yeah. I don't believe in random events, Jonathan. So I was actually in a course. It was a TMD course, and my brain's always working. It's always working. And somebody mentioned something about working with other physicians. I said, well, I had some really good relationships with other physicians and ENT groups and things like that. And so there happened to be a group that had kind of a medical campus, and they had internal medicine, they had cardiology, they had ENT. So I made a phone call over to a friend of mine, and long story short, she said, we would give anything for you to come over and help us, because we have no idea how to treat these patients and we have no idea who we can send them to. So it was kind of it kind of made me realize what a huge void this is it's in our country. So it's not just my area. And Jonathan, I think you've seen it too. So I decided as a hobby to share space for a couple days a week, a couple days a month to start. And within 3 months, I was there every Friday. A few months after that, I was there every Monday and Friday. And it opened up my eyes on the fact that there are too few people treating TMD and sleep properly. And then, I'm going to little teaser here, had no idea how much this was going to feed my general practice. It's surpassed all my expectations. It's amazing.
Well, and you're a couple websites down, but it's like, so the road from what you had when this first started. But so this is your main practice's website, and it's not just TMJ and sleep. It covers kind of all the things that you do, and then you went into this medical building, and I actually worked with you on developing this logo and this separate brand. And so this is not just, like I said, not just another location. I want to make that clear, but a whole separate brand. And so at that other office, you don't offer general dentistry or cosmetic
Correct.
dentistry services. I mean, you obviously don't promote yourself as a specialist, but this is just TMJ and sleep. And so when you started off, how many days a week were you seeing patients?
Twice a month, 2 Fridays a month.
2 Fridays a month. and now,
yeah.
Now where are you at?
Now it's a full-on practice. I'm there 2 to 3 days a week, and it's been an amazing accomplishment. It was. And again, I was very confident in what I wanted to do, but I didn't realize I was treating TMD and sleep patients for almost 15 years prior to this. In the last 7 years, that this has been open, I see double the amount of TMJ and sleep patients. Double. Because they find me because I'm viewed as a specialist, right? I'm not a general dentist. And you could probably chime in here, it's a lot easier to market a practice when all you're doing is 2 services. Right? You got TMJ and sleep. When you're in a general practice where you're doing kind of everything, it goes back to the adage of, jack of all trades, master of none. Well, my sleep and my TMJ and sleep practice, I'm a master, right? And so it's easier for me to market, and I believe it's easier for you to market for me. Is that correct?
That's absolutely right. I mean, just looking at the website again, both Google and human beings see this website, and the message is simple. I mean, Michigan's choice for TMJ and sleep apnea, not and cosmetics and Invisalign and general dentistry. I mean,
right.
This just shows a focused experience. And, in terms of search engine optimization, when Google comes to this, there are fewer keywords for them to have to keep track of. And therefore, up here, this is called the title tag. I'll get rid of my ribbon here. Whoops. I guess I'll make it really difficult to see there. But in terms of search engine optimization, I'm really not sure what I did there. In terms of search engine optimization, there are opportunities for us to tell Google, this is what this website's about. But when it's a practice-wide website that's all about everything you do, we have to figure out an umbrella, and usually that's just dentist or maybe cosmetic dentist, and then we sort of have to figure out how we say, but just because it's cosmetic dentistry doesn't mean that we don't also treat TMJ and sleep apnea. And so, obviously most dentists' websites have a TMJ page if that's something that they treat, and a sleep apnea page, and your website does as well. But Google can see this, and we can optimize your homepage for sleep apnea and TMJ treatment, and it performs a lot better because of it. But then, when patients talk to you, can you just talk about the difference when you get a patient at this office versus your Rochester practice?
Well, people are coming there for a reason. Now, I don't want to discourage people to think that they can't achieve this by just marketing these services in their own general practice, because I did it for years, and we were very successful with it, and we still are. It's a little bit easier when somebody finds you for like that one service or 2 services, whether it be TMJ and sleep or one or the other. It's a lot easier for me when I'm in my practice that is Michigan Center for TMJ and Sleep Wellness. They're not asking about dentistry. They're not asking about, I don't even do dentistry there. Okay. So they're asking about specific things. Now, that said, we have, because of this, really gotten smarter in our general practice too. We have patients who find us for these specific services, and we treat them the same way. So we've learned through this process. So I guess I don't want people to think, oh, well, I can't do this unless I open up a whole other practice. No, you can, but you just got to concentrate on the marketing. Have your website positioned properly, built properly, and optimized properly. And then you're going to have patients find you. You want to be the go-to person for TMJ and sleep. And that's what, and Jonathan knows, that's what I teach in my courses.
Yeah. You
can have the best skill set ever. If people don't know what you do, or you have not set yourself apart from other people, you can have the great skill set ever, but you never get a chance to use it.
That's right. And I'll just show here on my screen. have a link here. I'll put it in the description, but this is the course that Jeff is talking about. It's put on by Myotronics, and I would just encourage every dentist watching this, if you want to know more about doing what Jeff does, the way that Jeff does, because that's what I love about the way that you teach that course, is that you are really just telling them all about how you do what you do, and give them the recipe so that they could do the exact same thing. And so, I mean, that's what more can you ask for? Is like, if you do these things, it should work out this way. If you don't do these things, I can't tell you exactly what went wrong.
Yeah, I mean, listen, I'm very practical. Okay, there are a lot of people, especially in the TMJ and sleep apnea realm, that are a lot smarter than me. Okay, and that's not tongue in cheek. It's real. What I see is, how can I get patients to understand what I can do for them? How can I teach dentists and teams to implement, integrate these systems that I've proven? I mean, I've made all the mistakes. I have made the mistakes. I'm giving you guys the gold. I'm giving you the good stuff. That 2-day course, and good. No, I mean, you were there, Jonathan. I mean, I've never had such rave reviews, because people are like, this is exactly what I need. It wasn't fluff. It was real meat. And so that's what we do. That's what we want to treat. I want people to leave that course and be able to implement things on Monday and start having the success. Because if you're not treating a bunch of these patients, what is success? I'm glad that you know this. I know you have the knowledge. I know you're skilled, doc. It's all great. But if people aren't saying yes to this treatment, what are we doing this for? Right.
So you don't have to start a second office in order to do that, but just selfishly from a marketing standpoint, I would love for you to do that, because it will work the way that Jeff says, where it's like, this is all you do and you're amazing at it. And also, bonus points if you set it up kind of near the epicenter of your city, because Google will love that. But a good starting point would be this course, and like Jeff said, there's real meat there, and it's big picture, but it's also like, this is kind of a big picture conversation of starting another office. But what I love about the course is that there's little bite-sized things, good for team. They should bring their team, right?
Oh, please. Oh, my goodness. So Rachel, who is my assistant for almost 20 years, she started this practice with me. I cannot even tell you the value there. She has more of a following than me, I think. And I'm not joking. The team members, they respond to her. She just is such a great teacher and so approachable. And listen, docs, I can't teach your team as well as a team member can. So please, let's check our egos at the door. I know that we feel like we're the smartest people in the room. We really aren't. Our team really makes the magic happen. And if you get out of the way and let them succeed, you will have more success. And so that's a huge component of our class, because the team is what drives it. I mean, you can be the leader, and I feel like I'm a very good leader, but I could not do it without my team. So bring your team is the key to success, in my opinion.
Well, Jeff, thanks for being on the show today. We're going to close it out, but I just really appreciate all the expertise you shared with us.
Love being here, Jonathan. Thank you so much. Thank you for everything you do for me as well. You do an excellent job, and I wouldn't be here without your skills. So it's a mutually beneficial relationship. I mean, I gotta give you a little bit of gratitude.
Oh, thanks. Well, thank you for watching. Stay tuned for more episodes from Marketing Chairside coming soon.